Thank you for joining us. We're joined by Joe Barella, the head of the Department of Labor and Employment, U.S. Air Force Colonel Daniel Fedger of the 140th Wing Command of the National Guard, Dr. Eric France, our Chief Medical Officer for the state of Colorado, and Lauren Larson, the Budget Director. This is a different protocol. We want to make sure that we are modeling the best behavior to keep members of the journalistic corps safe, and of course our staff space. For those at home who don't see this, we are spacing apart members of the media. We will soon be going to a pool camera for future events. I know we weren't able to get that orchestrated today. We want to make sure that we are as transparent as possible, but that the press is able to continue to operate at as close to full capacity as possible when it's more important than ever before to get good information into the hands of Coloradans. As of today, we have 160 positive test results in the state for COVID-19 coronavirus. 20 are hospitalized. And that's just to point out that's what the testing tells us. We know there are likely thousands more in the state of Colorado. Our state has confirmed test results on over 1,200 people. Again, Colorado is ahead of where other states are on testing, but our whole nation is behind. And Colorado is no exception for that. We are doing our best to be one of the leading states, if not the leading state for testing, but scaling that up has been very frustrating and occupies a lot of my time and our operational time to better do that. To be clear, the 1,200 tested does not include in that denominator the negative tests from the private labs. As we scale up on the private lab side, Kaiser's doing testing, UC Health's doing testing, many others are. They immediately report positive test results to the state. They don't have to report negative test results. Again, we're getting some estimates. We're doing our best from a public health perspective, but it's not that one-on-one accurate denominator from all of the private lab partners, because their only requirement is to do positive. And to be clear, anybody with a relationship with Quest or LabCorp can do that testing. We know we need to test as much as possible, not only for the sake of the patient and the uncertainty, but because it gives policymakers and public health officials crucial information about where we need to direct resources and direct quarantine, isolation, and other orders. What is so frustrating about this virus is we are always, from a data perspective, chasing where it was 3 to 5 days ago. We're acting on information because of the incubation period and the onset of symptoms and the testing. The best information we will have is always going to be 3 to 5 days behind what is actually happening through the ground. So we're doing our best to extrapolate, to predict, to use modeling, but the data is a trailing indicator in terms of positives, and then after the positive to hospitalization, and ultimately to whatever the outcome is, there is a significant delay in that. In fact, many of the cases don't require hospitalization for 7 to 10 days into the infection. That's when they enter the severe stage that requires hospitalization. So we're doing our best to use forecasting, modeling, and indicators, but any of the hard data that we get is a trailing indicator. Experts nationally estimate that we are about where Italy was 2 weeks ago. And to be clear, Italy just passed the 2,000 death point today, and well over 10,000 cases, many that, like in America, have simply not been tested. Tomorrow, CDPHE is opening testing in Telluride in partnership with San Miguel County. We're going to be serving folks in the area to better identify the regional concerns, and we're looking forward to scaling up testing across the state as soon as we can with regards to equipment and personnel. Please remember that also Colorado has the capacity for private labs to conduct testing. We encourage anybody who has symptoms or believe they might have been exposed to coronavirus to call or email their doctor first, obtain a doctor's order for testing. Any medical lab or provider with a relationship to LabCorp and Quest, which cover most in the state, can do the testing. But don't just show up. You have to call your provider ahead of time. Look, while testing is important, we can't wait on that. We need to act to flatten the curve, and we need to be realistic. There are likely thousands of cases across the state that have not been diagnosed or tested, some of which are non-symptomatic, some of which are mildly symptomatic, and some of which are likely to enter severe symptomatic stages in the days ahead but are infectious. As I told you on Friday, our goal is to flatten that curve in Colorado to prevent a situation where our healthcare system and healthcare workforce are simply overwhelmed by those needing hospitalization. As I've also stated before, and it's important to know, over 80% of the cases will be folks with mild symptoms not requiring additional medical treatment. Most, but not all of that category are folks that are younger and healthier. But again, this has required hospitalization and has caused death in people of all ages. But to be clear, the danger is much more imminent for those over 60, especially those in their 70s and 80s, and those with respiratory or immunosuppressed conditions. I have a friend who's my age who's had lung conditions in the past and has respiratory conditions, and again, he is high at risk even though he's in his 40s. I am pleased to report that we have 50 new nurses in Colorado today from the Freedom Healthcare Staffing Company. We were able to get them ordered just under the wire. Again, we're hoping that we're a few days ahead of where other states are, not a lot. There's no new surge capacity available now for states who want it, but we got this in under the wire thanks to the emergency fund, disaster emergency fund. 50 new nurses arrived in Colorado today, are being deployed and getting their assignments to support our health needs. I also reiterate my call to registered nurses who are in other fields or have recently retired to contact your previous employer and offer your availability during a crisis if you need to come back to work, and that also applies to doctors, pharmacists, EMTs, and others. I want to thank everybody involved with this effort. We need to reduce the number of vulnerable people exposed to this virus. That's why we issued the strong guidance around limiting visitation in nursing homes, and we also need to engage in aggressive social distancing measures. Given the extreme risk to the high country, over the weekend, we ordered the closure of downhill ski areas for a week, again, likely renewable, but we'll look at data. And we strongly advise that all visitors and residents of Eagle, Summit, Pitkin, and Gunnison counties, and those who have visited there in the last week or two, minimize social contact. That's really important. We have limited healthcare capacity in the high country, and we also want to avoid disbursement both within the high country and for those who have returned to the metropolitan areas. But we need to do more, and we're announcing some of those initial steps today. Yesterday, CDPHE announced that we're following CDC guidance on preventing crowds of 50 or more from gathering with the guidance on that. I would indicate that we assembled our GERC and met today, and they unanimously voted for us to adopt and to operationalize CDC guidance in real time. So we're going to be doing our best as a state when the CDC issues guidelines to adapt those rapidly and then operationalize those in the Colorado context. Thank you. But again, we need to do a lot more. We're looking at further steps we can take in this area, and we want to make sure that these policies work and prevent the spread here in Colorado. In that same vein, effective immediately, State of Colorado and I are ordering temporary suspension for 30 days, again, renewable, of dine-in services at restaurants and bars. Again, these establishments can remain open, but that's for takeout, delivery, and room service. I talked to a number of restaurants and the Restaurant Association earlier today, encouraging them with additional safety protocols around delivery, around making sure that sick workers don't attend work. And we're closing large places of gathering. That includes gyms and theaters and casinos where large groups can gather. These steps are very painful for our state. And while, again, they may be an inconvenience to you if you're a customer, imagine how difficult they are for the workers and the owners of those facilities, many of whom will have a tough time remaining viable, the workers that will lose their jobs. We'll get to some of the work being done on the labor side, but these are very difficult decisions, the goal of which are to reduce the severity and duration of this public health crisis. Again, you don't want to be penny wise and pound foolish. If you try to squeeze a few more days or week of business into bars and clubs, you'd be looking at a much longer absolute closure and more drastic measures as a result of the lack of foresight that we hope we are showing by taking these actions today. We know that there's over 12,000 small restaurants, bars across the state, and I know firsthand they're some of the hardest business establishments to manage. I've been a success in business, but I've been a failure in the restaurant business. Unlike my predecessor, John Hickenlooper, who did well, I had 2 restaurants at different times that weren't able to make payroll. One was in business for several years before it went out. It's a tough business. It's tough for the owners, the managers. It's tough for the waiters, the wait staff, the bussers, and of course the entire supply chain. And there will be a time when we want to celebrate those local small businesses again. When it's safe, we want to go out, we want to go celebrate at bars and clubs, we want to dine out, we want to celebrate in places that we can congregate. But I think you all know who are watching this that day is not today. It's not tomorrow. It's not likely to be next week or the week after. Our hearts go out to the 240,000 employees in the food and beverage industry. Again, we want them to be creative, delivery, carry out other ways that they can continue to operate subject to CDC guidance and public health protocols. Colorado's Unemployment Insurance Division is also responding to many questions from both the employers and the employees. For employees who see a reduction in hours or layoffs, they can apply for unemployment benefits at coloradoui.gov, coloradoui.gov for those workers. Employers may also be eligible for programs to avoid layoffs, like the Work Share program. That allows employers to split the cost to retain employees with unemployment insurance. For instance, if a worker has to be cut from 40 hours to 20 hours, UI could pay 20 and the employer could pay 20. That's called the Work Share program. We are also anticipating additional federal action, again, with a pending bill before Congress, but likely subsequent efforts as well with regard to the economic recovery as we address this public health crisis. Our state's jobs database, connectingcolorado.com, will continue to post listings for statewide jobs available. There will likely be paid work as well as the need for volunteers to address many of the immediate health care needs and needs of the economy and the public health. And I know that this is a difficult time, but we're in this together and we're going to get through this together. I'm also announcing that all DMV facilities and all Department of Revenue facilities will be closed to the public for 1 month, March 18th to April 18th. But behind the scenes, many of the operations and processes can continue. You can renew online. State driver's license offices will be closed to the public. Again, continue to process the online driver's licenses. And for those that cannot complete renewals online, they can call the DMV call center during working hours at 303-205-5600. Customers who have appointments will need to reschedule those once normal operations have resumed. I also want to make sure that people know that with the closure of many schools in our state, that the Colorado Department of Education has received a waiver from the U.S. Department of Agriculture to continue serving free and reduced lunch to our students while schools are closed. That is the main source of sustenance for many low-income families. We are also encouraging students to take meals away from the meal sites to be consumed elsewhere to allow for that proper social distancing. As many of you know, my Budget Director, Lauren Larson, delivered her update per statute to the Joint Budget Committee about the effect of coronavirus to our state budget and our state economy. While numbers were provided per the statute, I want to be clear that the economic situation is in complete flux. Until we have a better idea what's going on, I wouldn't put any stock in economic forecasts. Everybody is guessing because nobody truly knows the trajectory of both the virus as well as the medium and long-term economic impact. We want to do everything we can to minimize the long-term economic impact of this global pandemic and ensure that Colorado is prepared to come back stronger than ever when this crisis is over. And I know at this time, folks are anxious and feel often that they're not in control. But as we think about it, we really are in control. We're all in control of how we respond in our own lives. There's only so much that any government can do. We all have to take our personal responsibility seriously. And for everybody who is taking this seriously, you are a hero. It's not easy to sacrifice. We're in this together. And we hope to promote a culture of sharing stories with one another. We need to spread the word about what we're doing in best practices and the need to socially distance ourselves. So today we're launching #DoingMyPartCO, where we're encouraging folks to do the right thing and using social media, share on social media with the #DoingMyPartCO, and challenging 5 friends or tagging 5 friends to do the same. So that could be, you know, simply a 10-second video of you washing your hands correctly. It could mean showing working from home, if you can, walking or biking somewhere, watching a movie at home with popcorn rather than going to a theater, FaceTiming with grandma instead of going to visit her, getting groceries or medicine for an elderly neighbor and leaving them on their doorstep. And of course, I also want to make sure, yes, taking it easy on the supermarkets and the toilet paper. There is no interruption to supply chains. We have ag and trucking all functional. There are months and months of supplies that are intermediate to the supply chain. So there is everybody should calm down with regard to that. There is no immediate need to purchase those items. The supply chain is safe, and we want to make sure that we're not causing our own problem here by these short-term runs on products. These are positive steps that folks across the state are doing, and let's share them. I mean, let's be honest, a lot of people are looking for something to do. Let's share Doing My Part CO. Share what you're doing with your kids while they're home from school. Share what you're doing at home if your work isn't allowing you to come in. Share what you're doing if you're in isolation and quarantine. Let's be part of a virtual community together to help reduce anxiety and support one another. I also want to ask our friends in the media to help spread the word about hashtag Doing My Part CO and help share what we're all doing that shows that we can live with social distancing here in Colorado and protect people's lives. And, you know, in doing right, we know that it can be hard, and that's hard on, of course, you, our residents, in your homes. It means hard on healthcare workers, our most vulnerable. And we're hoping that people do their best to cope with the mental health challenges, the behavioral challenges that come with isolation and loneliness. And that might mean things like taking breaks from watching, reading, or listening to alarming news stories. You can read all day and night about what's going on in Italy and Europe and increasingly here, but you can read an article or two and then, again, take a break. It's bad, but we're going to get through this. We're going to get through this. Hearing about the pandemic all day, 24/7, might be my job to manage, but it doesn't need to be yours. Enjoy those other things in life. Take care of your body. Take breaths, stretch, or pray, or meditate. Try to eat healthy and well-balanced meals. Exercise regularly. Enjoy our great outdoors. Whether it's bird watching or hiking or biking, what a great way to exercise social distancing in an environment where you and your family are in our great outdoors. Our kids went biking today and had a great time. And if you're not in quarantine or isolation, take advantage of our national, state, and local parks and unwind, right? Maybe it's time to start a new book series. Maybe it's time to start a new TV series. Practice an instrument. You could learn a new language. Catch up on family time. Read with your kids. Do craft projects. Play board games or put on a play or Muppet show and share it. And share it with others to bring joy to them, but also to give other Coloradans ideas about what we can be doing in these challenging times to connect with those who are most important to us and appreciate what's most important in life. And yes, connect with others. Just because you can't be in the same room doesn't mean that this crisis can't bring us together. Look through those contacts on your phone. Call a friend or family member you haven't spoken with in months or years. Talk with people you trust about your concerns and how you're feeling. Have a webcam dinner party with friends and family and share recipes and pictures of food on social media. If you've got these ideas, if you're doing these things, if you have other ideas, share them and put the hashtag DoingMyPartCO, hashtag DoingMyPartCO. Look, this isn't going to be easy, but the more seriously we take this public health emergency, the better we can weather the storm and get through this crisis with as little loss of life and as little damage to our economy as possible. The fewer gatherings in the short and medium term, the fewer people at those gatherings, the better the chance we have to reduce the trajectory, to bend the curve, to save lives. And we say saving lives, right? We say, oh, now there's 2,000 fatalities in Italy and where Italy was 2 weeks ago Italy, a country less than 20% our size. But, you know, let's put a face on those lives when you think about our own behavior, when you think about what you might be doing and how you might be isolating. The face, the life, it could be your grandmother, it could be your grandfather, it could be your aunt or uncle, your parent. And of course, it could even be your own that hangs in the balance of the decisions that you make, that we make. So be smart, be safe, don't worry, that doesn't help. Find fulfilling ways to become closer to those who mean the most to you in this challenging time. And let's look out for one another so we can get through this as a state, as a nation, as a world, and get back on our feet as quickly as we possibly can. With that, I'll be happy to take some questions.
Governor, you said that we're about 2 weeks behind Italy. Italy is under curfew. There are 6 counties in San Francisco, shelter in place as we speak. The president today said he was considering certain sections of the country to possibly do that in. Has there been any discussion about putting Colorado under a curfew?
Well, we're taking aggressive action, we hope ahead of where Italy did at a similar stage, by closing restaurants, theaters, bars. We're preventing a lot of those places that people congregate, 50, 100, 200, where the disease is rapidly spread. We want people to make sure that they stay safe during this crisis. We will be adopting any CDC guidance and operationalizing it in Colorado as soon as is possible, generally speaking within the day.
In some parts of the country, there's been a call for the Army Corps of Engineers to help build additional hospital space. You mentioned that there are quite possibly thousands of more people here who will test positive for coronavirus. Do you have plans to build additional hospital space, ICU beds, and bring in ventilators should we get to that level of need?
We activated the National Guard a number of days ago. They actually operated the drive-through test facility. They're being deployed in different areas of the state to assist with the surge. We would welcome help from the Army National Guard and any other federal resources in this crisis. Again, don't talk about them, get them here, put them on the ground, we'll put them to work. And I assume when you mean build, there's not obviously the time for construction. We already have in our emergency planning looking at empty buildings and other places where we can set up cots, where we can set up temporary overflow facilities. Many of the private providers are also establishing their contingency plans around that surge. So patients can be housed. And keep in mind, this isn't just coronavirus patients. Everybody else has every other ailment that normally happens. So you're still going to have cancer, you're still going to have people getting heart attacks, you're still going to have every other thing that happens, appendicitis that has to have an operation within, 24 or 48 hours. So we, again, need to have that capability and not subsume the entire thing by coronavirus. So in some cases, there will be off-site centers doing non-coronavirus work. In some cases, those sites will be dedicated to people who might be contagious with the proper precautions for coronavirus.
Why are daycares still open, and is there a possibility that you may order them to close?
Yeah, daycares are currently open out of necessity. It's important that they engage in social distancing and best practices. And when we talk about this virus in children, thank God there's some consolation that the negative health impact, the mortality rate for children is de minimis. Thank God. But children remain a vector in transmission. So we're not so much worried about the health of little Johnny and little Mary. We're worried about everybody's health, but it's minor in them. We are worried about little Johnny and little Mary infecting their grandparents and others who are more vulnerable. We know that families have kids. They need these services. We want to do our best to encourage social distancing and best practices. And kids are going to be somewhere and doing something. And so we want them doing the best possible thing to prevent them from being a vector for further transmission of the virus.
Governor, the GERT also today was debating how to define essential and non-essential businesses. How close are we to shutting down non-essential businesses in Colorado?
The work is very important to begin the work of figuring out where, from a database perspective, where and how people congregate, how we can further avoid a large social gathering and engage in aggressive social distancing. These steps today, theaters, in-person dining in restaurants, gyms, casinos. These are places that we know people gather, right? If you heard the call today, people were talking about different kinds of stores and different things. Look, if you're going shopping, go shopping, but again, try to keep that distance. There's no need to go out and buy everything right now. We're not running out. The supply chains have months of lead time, months and months of lead time, right? And again, while this event will last months, it's not going to last years. Yeah, there's a public health order that is issued with regard to those matters, similar to the one that Denver issued earlier today. I don't think it's necessarily identical, but it's very similar to Denver's. And I want to talk about how the state of Colorado operates, because when you look at, for instance, how things went down over the weekend, you had the two largest resort operators in Colorado, Vail and Alterra, closing down the largest capacity resorts in our state. What this absolutely necessitated was the closure of the others, because when you close some, you can't have all those more and more people congregating on fewer and fewer open places. So let's say Denver closed restaurants and a couple other cities, but Sterling, Colorado tried to keep them open. You can't have hundreds or thousands of people driving to Sterling to go to a bar and infecting the people of Sterling. So you have to look statewide as the action grows from the bottom-up local response from the very capable and competent public health departments, as well as our private sector partners.
Drive up. What's the change in procedure there? Is that something?
Well, that's either today or tomorrow. We're happy to walk you through the procedure on how that's being run. It is both CDPHE and I think supported by the Colorado National Guard to help us understand exactly what's going on in that community 5 to 7 days before it manifests. This is what's so important. We're chasing the ghost. We're 5 to 7 days after with seeing people showing up, even 10 days if they're coming to hospitals. We just don't see it. So that's why the testing is so critical, and while we're also trying to get a good sense of what's going on in different areas of our state. Yes?
Short of protective gear for first responders, those PPEs. In fact, he even said within the next few days, services could be halted if they don't get help from federal or state government. Is that true? And if so, what are you guys doing about it?
Well, I can't comment on where Denver is. We are doing everything we can to tap the emergency federal supply. We have our state supply that's already been deployed. I believe in Eagle County with regard to masks. I'd have to double check that. It could have been Pitkin or Summit, but I think it was Eagle that we already moved some supplies to. We have limited capacity, especially for a population center like Denver, if needed, and that's why we need the federal emergency equipment as well. Of what?
The protective.
Well, again, it depends what you're talking about. The surge has not yet happened. We are worried about making sure we have the right protective gear for what we think is happening now, but will manifest in 5 to 10 days. And then, of course, we're worried about what comes 5 to 10 days after that. So, no, there is no shortage right now of people who have COVID-19. The people have protected gear. They're being administered. We want to make sure that we don't have a shortage in 5 to 10 days based on where we think we are now. And that's why we've really elevated that issue around supplies in our emergency command center. I met with our emergency command center folks late last night. I will be there regularly in the coming days and weeks. We have a strong support structure to do our best across every area on the physical space side, the material side, and the personnel side of meeting this need, both on the public side as well as working with our private healthcare partners.
Are you considering limiting the number of people who can gather even further?
For what?
Like the number of people who can gather in one place?
That guidance is currently 50 and up, right? So yes, if you have 8 people or 10 people coming to your birthday, you can still have it. I think that many citizens are leading on this. Again, I think it's very advisable if you're having a 30 or 40 person event to go ahead and cancel that or delay that. Many families are doing that. Our official guidance at this point is consistent with the CDC guidance, which is 50 and up we're not recommending. Yes, and if that's CDC guidance, we'll be adopting it. Expeditiously. That's what the GERC voted to do. We haven't seen that guidance yet from the CDC. But again, we want to be ahead of the curve in Colorado. That's why we are acting now, closing down in-restaurant dining, bars in particular, clubs. These are places that young people congregate. Some might be positive and asymptomatic, and spreading it with uncles and aunts and grandparents.
Scaling up testing is frustrating. Today's the second straight day without drive-up testing. No future drive-up testing at this point is scheduled. How far behind with the number of tests are we where you'd like to see us, and who's responsible for that frustration?
So Colorado is ahead of where other states are with testing. That's one of the reasons we have more positive results. It's not because the virus is more advanced here. It's because we've tested more people. But our entire nation is behind, and we're unable to get the supplies we need to scale this up as rapidly as we can. We've created a part of our command structure that will be tasked exclusively with two things. Scaling testing. When you look at the way the country of Korea has successfully handled the virus, hundreds of thousands of tests, versus the country of Italy, much more difficulty scaling up testing. I feel that testing is a critical piece of this. But it's not just testing, it's also maximizing compliance with the steps that are needed to prevent the spread of the virus, meaning supporting those who test positive and who have pending tests, the 80–85% that aren't being hospitalized, that they comply with the orders to remain isolated. Meaning, what do you need? Do you need somebody to bring groceries to your doorstep? Do you need an upgrade in your cable package? Do you need books from the library dropped off at your doorstep? So these are all the things we're thinking about as we scale up testing. It's not just the testing. The testing is critical from a data perspective to inform our decisions, because that gives us, you're still chasing a ghost, but you're 3 days or 4 days behind instead of 5 to 10 days behind when you're chasing symptoms like we are now. So it helps us catch up. You're still 3 or 4 days behind, but you're not 8 to 10 days behind. But it also prevents the spread, and that remains a focus to rapidly scale that up. Let's go to, yes, Jesse? Oh, I'm sorry.
5 to 10 days, 1, and 2. I don't know if you were on that call with the president this morning, but did he indicate if Colorado was one of those places that might be locked down?
The president was not specific about locking down any particular place. He was actually frustratingly general on the call. The call lasted for some time, the president, the vice president, and others. While our one-on-one conversations with the CDC director, the vice president, have been very valuable, these broadcasted conversations have been of limited material value to us in actually figuring out what we're getting and when we're getting it. What was the first part of your question? So it's not a one-time surge. We're expecting a build. We are, again, looking at the number of people who've tested positive, the likely people who have been exposed, and then that lag time of 7 to 10 days before the people who were exposed in the last few days might require hospitalization for the 15 to 20% that do. Marianne?
What are the consequences for bars and restaurants that don't follow this public health order? Tomorrow's St. Patrick's Day.
Well, public health orders are binding. Denver closed down theirs. The state is closing down the bars and restaurants, and it's absolutely critical that folks know that as soon as the public health situation allows it, we want to be the first and encourage. I don't even drink, Marianne, but I'm going to toast when this is over at several bars around Colorado.
Guidelines or rules around food delivery, takeout?
On the call with the restaurants today, we had over 60 or 70 restaurants. Some don't have the facility to go to delivery or drive-through. Many of them are going to delivery or already have that. Yes, we recommended that the person doing the delivery leave the food at the doorstep. They call or text, or they ring the doorbell, and they back off, to a distance of 10 or 15 feet to make sure the food is received or payment is made. So precautions like that should be made. But again, there's risk in any contact, but the one-on-one there, a little bit less worry than having 300 people in a bar in Denver all rubbing shoulders and drinking together. I mean, that's the big source of transmission that we are worried about. We are not there. First of all, no government can ever put an end to individual person-to-person transactions and relationships, nor should they. But we want people to be safe and limit those to the extent practicable. Mm-hmm.
RTV or
Yeah, those are better questions for RTD and rideshare. Again, we're in conversation with both public and private sector companies. One of those is public, one is private, about how we can better engage in spacing. People need to get places. Healthcare workers need to get to work. Even in this surge, people have to go to and from work. Many are telecommuting. We are moving, by the way, we're implementing telecommuting protocols at the state government to maximize the number of people who can telecommute. Many private sector companies are doing that as well, really looking at, okay, how many people need to be here and how many can do their job telecommuting on an emergency basis. That has two advantages. One, a lot of folks have kids and they can't work if they don't telecommute, given the closure of the schools. The second is it allows for social spacing in the work environment. I mean, just think in your head, okay, it's every 3 cubicles. A person, this person's telecommuting, they're not there, this person's not there, and a cubicle, person in a cubicle. So it allows for more social spacing, and it allows for those who can't be at work to be able to continue to be productive in an economy in an increasingly challenging situation. Yes?
With the data that you were talking about.
With the
why
what?
not- With the data that you were mentioning earlier, why not order private testing labs to report their negative tests so that we have a better idea of total?
Yeah, we're looking at all of that. They're struggling to catch up too. There's a deluge, public, private, everywhere. So we're looking at getting the most operational data we can. And yes, we're looking at additional steps we can take to make that denominator more accurate. We would love that information. We're getting some of it. We hope to find ways to get more of it or all of it.
Closing in the state, are you shutting the restaurants down across the state?
That's happening now. The order is pending. You'll get a copy of it when it goes live. Our counsel is here. Today, it is today. Yeah, I don't know whether it's been issued as of this hour, as of this moment, but it's being written and issued in real time. Last question.
Says that he suspects there's maybe 100,000, or more coronavirus cases in that state. I know you said we likely have thousands more than we know about here, but can we get any more specific if it's as dire as the Ohio governor does?
So we're chasing trailing indicators. The testing is trailing because you're not going to test till you have symptoms. You're talking 3 to 5 days. The hospitalization is trailing. You're talking 7 to 10 days. So at any given time, when we scale testing, we'll have an accurate picture of where we were 3 to 5 days ago. We have not scaled it sufficiently to have that today. We do know how many hospitalizations we have. We have 20. So that's an accurate picture of where we were 7 to 10 days ago with regard to infection. So in short, while we have 160 positive cases, the best estimate from our state epidemiologists and others is that we have thousands of cases that in Colorado today, with a preponderance and a higher percentage with the connection to the high country, either as the source of the infection or they were there and they've moved elsewhere, which is why if you have visited in the last week and spent time in any of our mountain resort communities, particularly Eagle Summit, Gunnison, Pitkin County, be careful. We encourage you to avoid unnecessary social contact. And of course, if you are symptomatic in the next few days, we would recommend testing. We've seen extensive community spread in Eagle County and suspected community spread at a higher level in Summit and Pitkin. It is still limited community spread in Denver. We hope to do our best to keep it that way by closing down the theaters and restaurants and bars. Let me just conclude how, again, this is very hard for any governor, especially, one from the private sector, which is what I come from in business. This is really hard just to be able to say this is closing a business, a livelihood, a way that people put food on their table. But this is the overwhelming expert opinion, scientific opinion. It's what will guide me during this period. I'm not an MD. I don't have a PhD in public health. Thankfully, there are people on my staff and council of advisors who do, who know that world well, and who know that by acting boldly now, we are saving lives and we're minimizing the medium and long-term economic damage to businesses and workers in our state of Colorado. Thank you.